Recommendation 1. Recommended to health and social care service providers, key agencies in the city such as the NHS Vale of York Clinical Commissioning Group, City of York Council and York Teaching Hospital NHS Foundation Trust. The recommendation was to provide deaf awareness training for all staff who have contact with the public, including receptionists and practice managers. The training should be delivered by an accredited trainer. Deaf awareness training would enable staff to understand the communication needs of deaf people, understand who is responsible for booking interpreters, know how to book interpreters and the standards required. The Association of Sign Language Interpreters, ASLI, believe that the only way to ensure fair access is through the provision of a professional interpreter who is registered with the National Register of Communication Professionals, the NRCPD. Recommendation 2. Recommended to health and social care service providers. The recommendation: advertise and promote interpreting provision by displaying posters in surgeries, hospital and council offices to remind staff to book an interpreter, making a checklist or leaflet available to all staff as a reminder of their responsibilities to deaf patients and how to book interpreters. Recommendation 3. Recommended to health and social care service providers. The recommendation to review how providers become aware of the preferred language or preferred method of communication of their patients and carers who are deaf. Recommendation 4. Recommended to GP practices. The recommendation to review how deaf patients book appointments and how appointments are confirmed, making sure a range of options are available: email, online, text, SMS, type talk, fax, and face-to-face. Recommendation 5. Recommended to key agencies in the city such as NHS Vale of York Clinical Commissioning Group, City of York Council and York Teaching Hospital NHS Trust. Consider how public meetings can be made accessible to the deaf community. The preferred option is that BSL interpreters are booked in advance of all key public meetings, and publicity materials for events indicate that interpreters have been booked. Recommendation 6. Recommended to GP practices NHS England area team. Consider holding a regular walk-in surgery or clinic for deaf people at a city centre location with interpreters provided. Recommendation 7. Recommended to key agencies in the city such as NHS Vale of York Clinical Commissioning Group, City of York Council and York Teaching Hospital NHS Foundation Trust. Consider creating a central fund to provide a shared pool of interpreters. A list of interpreters could be held centrally and they could be booked in advance for events, meetings, etc., or specific events for deaf people. Recommendation 8. Recommended 2. Commissioners of Health and Social Care Services. Consider access to services for deaf people when tendering and reviewing contracts. Recommendation 9. Recommended 2. Health and Social Care Service Providers. Adopt simple visual indicators in waiting rooms and reception areas. For example, give everyone a number when they arrive and display the number on a screen when it is their turn. Recommendation 10. Recommended 2. Health and Social Care Service Providers. Review the accessibility of standard letters and consider making video clips of them.